Hey guys, welcome to another video on my channel HAIRLICIOUSLY. I hope all of you guys have been doing great. So if you guys are new to this channel, please make sure to subscribe. I will be talking about the latest hair loss treatments and my update on my hair transplant and talk about anything pertaining to hair loss. So today in this video, I wanted to talk about another type of product that is currently in the pipelines as far as treating male pattern baldness. And it is an Italian company called Cassiopea. And they actually have a brand name called Breezula, which is their anti-androgen containing composition for the treatment of male pattern baldness. They also have another product called Winlevi, which is also an anti-androgen, which they're currently in phase 3 for the treatment of acne, and they've actually had really good results. The two different products actually used the same type of active ingredient. And so I think it'd be useful to kind of use that acne for phase 3 as a guideline to kind of predict what the phase 2, which is currently in the pipelines for Breezula, is in. And since you guys are more interested in Breezula, I will be going into details of what that entails. But as you guys can see, it's been about a week since I've last updated my channel. And within that week, I've actually gotten a haircut. So I want to kind of show you guys up close how it looks like. So there's the hairline. And I feel like the shorter hair suits me better because, it's not as messy. And since I do have some type of thinning here, some of you guys have noticed that I do have a little bit of thinning on the sides. And I feel like cutting it short kind of hides away the fact that I'm actually thinning on the sides. So here's how it looks, just to give you guys an update. And one other thing is I am also applying minoxidil on my eyebrows. I do have some patchy areas towards the corner. I know that's a lot of Asian guys and even, other guys from different ethnic groups tend to have, lack of hair on the end corners of their eyebrows. So I've been applying minoxidil 5% once a day. I actually started yesterday, so anytime I post videos, you guys can see an update. But once I do see some progress, I will let you guys know. So I'm just going to go ahead and dive into the topic of Breezula. Breezula was also known as CB0301, which is a topical containing the active ingredient clascoterone, which is applied to the scalp twice a day to reduce hair miniaturization by antagonizing androgen receptors. And if that is not controlled, it shrinks the hair follicles and causes thinning and hair loss. Breezula is a different formulation of the same application containing Winlevi, which I said was for treatment of acne. But Breezula is going to contain a higher concentration in the lotion designed to penetrate the scalp. So the mechanism of action involves, in male pattern baldness, we have high levels of DHT, which shorten the hair cycle and gradually cause the scalp follicles to miniaturize, which results in thinner and thinner hairs until the follicles just stop growing. Breezula, what it does is it's going to act as a cutaneous level on the scalp by blocking DHT interaction with the specific hair follicle androgen receptors. And what it also does is that it's going to reduce the skin's production of prostaglandin D2, which in elevated levels, it can actually inhibit hair growth. And the good thing about Breezula is that it actually does not interfere with the hormonal and in particular the androgenetic profiles of patients. That means that there's not going to be any issues when it comes to low libido, sexual behavior, testicular pain, man boobs, anything like that, because sexual behavior is actually unaffected in clinical trials up to date, and we are actually currently in clinical trial phase 2. So this would be a game changer for those who want to take Finasteride 1 milligram per day, but due to sexual side effects, they are actually unable to do so. So this medication would be very useful for those who do suffer from side effects, or from those who actually are concerned about experiencing these side effects, whether it be sexual, neurological, whatever different types of side effects that they might encounter. So currently, Breezula is currently undergoing, like I said, their phase 2 clinical trials in Germany for dose ranging. Doses are ranging from a variety of different dosages, and they're evaluating the efficacy and safety of clascoterone. And there's 404 subjects who are suffering from mild to severe or moderate androgenic alopecia in the temple and vertex regions. So these are people that are suffering from a normal 3 to 5. And same thing with Finasteride. We need to have some type of hair miniaturization in order for the drug to be effective. So if you guys are completely bald, I feel like this drug is not going to be effective. But the good thing is that a lot of us are suffering from male pattern baldness somewhere between the ranges of normal 3 to normal 5. So even in my case, it would be very beneficial to apply this topical and then prevent any further hair miniaturization. So the different dosages were set at 2.5% solution, 5%, 7.5%, and these were all applied twice a day. And the last set was at 7.5% applied once a day. And we also had the vehicle solution, which was applied twice a day. And the co-primary efficacy endpoints being evaluated in the trial were number 1, change from baseline in non-vellus target area hair count at month 12. And then number 2, hair growth assessment score at month 12. So the target area is defined as an area of 1 square centimeter. So let's go ahead and take a look at the 6-month interim analysis efficacy results. As you guys can see in this graph, we have the primary endpoints at 6 months. We have clascoterone at 2.5, clascoterone at 5%, and we have it at 7.5%. The BID right there stands for the fact that it's applied twice a day. And on the right side, we have the clascoterone 7.5% QD, which means that it's only applied once per day. And then on the far right, we have the vehicle. So more subjects in all active groups saw an increase in their hair growth compared to the placebo group. And as a reference, these phase 2 dose ranging interim results for targeted area for hair count for the 7.5% BID dose can be compared to the 12-month TAHC results shown in the oral Propecia NDA. So clascoterone 7.5% BID reaches at 6 months the efficacy seen by oral Propecia. In the clinical study described in the NDA, Propecia 1 milligram oral once a day attained a TACH of 107 at 12 months treatment for a target of 1-inch diameter circle. This compares to a TACH in a 1 square centimeter area of 20.1 for Propecia compared to 20.8 for clascoterone 7.5% twice a day. Furthermore, Cassiopea expects that the side effect profiles of clascoterone, a topical anti-androgen, will be much more favorable than that of an oral androgen modulator with its associated systemic side effects. So a 6-month topical applied twice a day actually gave similar results to what oral Propecia did in 12 months. It is expected that the 12-month results from clascoterone will be even superior. And as far as safety, the API of Breezula is the same as the acne medication that the company is currently researching in phase 3 for Winlevi. And both product candidates actually have the same safety profile, which is a good thing. Although Breezula has a higher concentration of this API because the scalp is less permeable than facial skin, the systemic penetration of the two product candidates is substantially the same. We know that Breezula is around 5% to 7.5%. And then we know that the treatment for acne is 1%. But then because of the fact that the scalp is actually less permeable than applying for acne in the skin, it has a stronger dosage. But Winlevi already has good results from phase 3 for the treatment of acne. And because it has a very clean safety profile, it is expected for commercialization in 2020. So safety-wise, I don't think that we need to worry about anything as far as, adverse side effects. Breezula phase 3 is expected to happen in the near future. We don't currently have a date because we are still in the process for phase 2. If it does end up getting approved, Breezula would be the first FDA-approved anti-androgen topical product for the treatment of male pattern baldness. Now, Cassiopea's product pipeline page has Breezula the market launch in 2022, so we obviously need to still wait a few years until the end results and see if it's going to actually be effective or not. But, it's always nice to see these companies always researching. And, there's so many of the pipelines that hopefully at least one of these are going to be able to be a game changer for us. And even if Breezula works out, it's still going to be a game changer because people who are suffering from, like I said, side effects of Propecia, would be able to use this topical. And for the longest time, we've been looking for topicals. There's people that were using Finasteride topical on their scalps. We have RU58841. Currently we have minoxidil, and there's other types of topicals that people are applying. But right now, this is actually being, researched. It's going through phase 2, and they're saying that it's more effective than Propecia at 6 months. So we'll see what happens. And if you guys have any questions, please make sure to leave me some comments below. If you guys think this is actually going to work, please let me know. If you guys also do want to get an update on Shiseido's RCH01, there has been a small update. Please let me know. It has something to deal with their commercialization and trying to market and accelerate their the marketing without them actually completing all of their clinical trials. So if you guys are interested in that, please let me know in the comments below and I will give you guys an update. But thanks for watching, guys. If you guys like this video, please give it a thumbs up. Make sure to hit that like button and stay tuned for more videos on the latest hair loss treatments and hair transplant topics. Thanks again, and I'll talk to you guys next time. Bye.